Today we will be talking about obsessive compulsive personality disorders, OCPD. While 1 in every 25 people suffer from OCPD is a separate syndrome which is often used as a substitute for other anxiety or obsession-ridden behaviors that do not affect the individual's life with as much severity. One has to distinguish between OCD and OCPD. Obsessive Compulsive Personality Disorder, which is a syndrome where individuals seem to be overtly obsessive about things like rules, orderliness, and control. If a person is obsessed with cleanliness, they will have issues with allowing even normal amount of dirt, with that won't affect their normal life. Obsessive personalities, also known as anarchistic personalities, tend to do things that are in a perfect manner because they are not okay with trying to deviate from what they expect in a situation or from themselves. However, this does not make it OCD, as that can only be diagnosed when an involuntary pattern is repeated. Some of the chief characteristics or symptoms of OCPD is seen in traits such as lack of generosity, hoarding, and pushing oneself to perform better at the expense of leisurely activities or friendships. OCPD individuals have set norms, rules, and regulations, and they are more symptomatic on that. If not followed, they get irritable or angry and then try and fix it. With such attention to detail and zeal, such personality types tend to do well at their work, but usually at the cost of their aspects of their lives. Because of the time and attention to quality, such a person will involve a lot of personal time and have good outcomes as a result of it. One of the biggest complications that arise in the syndrome is that the individual will have complications in long-term and interpersonal relationship with others. This could be because of their high expectations of the perfect partner, or because of not expressing themselves for fear of not being perfect. Other ways in which their life can be affected is due to a general lack of flexibility from routine, perfectionism, emotional volatility or discord, hoarding, extreme indecisiveness, depression, and or being unable to cope with new situations. Therapy is effective in learning new coping skills and helping the individual deal with daily stresses of life. Many personality disorders treatments focus on psychotherapy to target and reshape the problematic traits that are creating distress. To this point, there has been a limited evidence-based examination regarding which therapy styles work best and how they create change. Because of this gap in the research, mental health professionals must employ techniques and therapies that are successful in treating other disorders. Some talk therapy options for OCPD include cognitive behavioral therapy, CBT, and psychodynamic therapy. In CBT, the therapist acts as a teacher and teammate to educate the help people understand the connections between thoughts, feelings, and behavior. During this process, the therapist will help a person recognize core beliefs and how these affects happiness and relationships. A person who has OCPD may believe that perfectionism is a positive trait and that they must control their environment and the people within it to achieve success. A therapist can attempt to point out the flaws in the way of thinking and provide alternatives. Psychodynamic therapy uses the principles of psychoanalysis and transference-focused therapy. In psychodynamic therapy, the aim is to help patients appreciate the connection between past experiences and current feelings and actions by understanding unconscious thoughts. In terms of OCPD, this approach makes sense. Experts theorize that the need for perfectionism and control arises from a desire for attention or acceptance from parents who were unavailable or overly harsh. Tapping into this connection could create the needed change. That's it for today. Stay tuned to our channel for more videos.